Agatha?
Yes, we can hear you. Sorry for that.
Very good, very good. Thank you. Well, I'm sorry about that, and good morning and welcome. I'm Rina Gomez, a Senior Employee Benefits Specialist in the Human Resources Department of Miami-Dade County. And I'm also an adjunct professor at Florida International University. And today I have the privilege of being the moderator of the first session. Our topic is human resources in the pandemic, work-life balance, telework, flexible work arrangements, and hiring during and post-pandemic. As we all know, 2020 brought dramatic changes to almost all aspects of business operations, but none more so than human resources. From widespread adoption of work from home to safety and distance requirements for job tasks that cannot be performed remotely, human resources has been critical in the transition to the new normal. Luckily, however, today, our panel is composed by experts in this area. They all have a combined experience in human resources of over 110 years.
Wow, that's
110. I think most of that's me. I think.
wow.
It is impressive.
I'm almost 110 years old, right?
I know, right? And then one can think that they have seen it all. With so many years of experience altogether, they might have seen it all, right? But maybe not. Who was expecting the pandemic? Who was expecting COVID would come around? So being said that, I'm here honored to introduce our panelists in alphabetical order. We have Mr. William Collins. He is currently the Director of Human Resources and Risk Manager for the City of Miami Springs. His previous employers include the University of Massachusetts and the Human Resources Departments of Miami-Dade County and the City of Miami. Mrs. Arlene Cuellar, who joined the Human Resources Department of Miami-Dade County in 1988. And in October of 2013, she was appointed as the Director of the Human Resources Department. Mr. David Kahn is the Director of Human Resources for Broward County, and he is the author of Cape Spandex Briefcase, Leadership Lessons from Superheroes. That is my next reading. The book is on its way from Amazon, David. Mr. John Pratt is our fourth panelist, and he is the Human Resources Director for the City of Doral. He has more than 37 years of experience in public sector human resources management, and he is also a former Miami-Dade County employee. That is our panel, and it is exciting to have them all together here, and I can't wait to hear their experiences and their opinions. But before I begin, I'd like to ask our panelists to please have fun with this panel. And if you have any questions from the other panelists, or if you want to add a comment to what the other panelists have said, please feel free to do so. And then towards the end, we're going to have about 5 to 10 minutes for questions and answers from our audience. So just, if you could, I'm going to let each one of the panelists to introduce themselves in about 3 minutes. If you can please tell us a little bit more about you. And I would love to hear an anecdote that you have experienced during these 11 months of COVID-19. So besides of that, I'd like to also hear, and I'm sure the audience would like to hear as well, what happened when you saw that COVID-19 was coming, that it was serious? We saw other countries and big cities that were turning into ghost towns. What was your first reaction in action to safeguard your workforce? So let's just get started with Mr. Collins, and then Mrs. Boyer, and then Mr. Gann, and then Mr. Prats.
Okay, so you want me to tell you about myself for maybe 3 minutes, right?
Right.
Okay, so my name is Bill Collins. I am the HR Director and Risk Manager for the City of Miami Springs. And I've been with the City of Miami Springs for just over 5 years. I think it's 5 years now, almost 5 years maybe. And it has been a real challenge. Most of my experience has actually been in larger organizations, and I did work in the county. Miami-Dade County. I worked with Arlene and John at one point in time. We were both we were all in the same department. So I've had experience there. I've had experience at the city of Miami, and of course the University of Massachusetts, and I'm pretty familiar with some of the larger operations. This has been a completely different experience for me working for the city of Miami Springs. We are a two-person office. I'm the director. I have an assistant and HR specialist. We work together as a team to provide all of the HR services for the city of Miami Springs, everything from recruitment to benefits to compensation to training, just about everything you can imagine. Payroll is handled by our finance department, but I'm involved with every single aspect of that every day. I'm maxed out on my vacation leave. I haven't taken a vacation probably in over a year. It is definitely a very challenging experience. So, and I think, I know that Rena has designed this panel to show how there are different experiences between the county, which is a very large employer, the city of Doral, which is a medium-sized employer, and the city of Miami Springs, which is a relatively small employer. So that's it. I'll talk more about the city of Miami Springs and how COVID impacted the workforce as we discuss the issue. So
thank you, Bill. Arlene.
Good morning, everybody, and good morning, Rena. Thank you, first of all, for the invitation to be part of this panel. It's an honor and a privilege to be here with everybody this morning. Again, my name is Arlene Cuellar, and I am the Human Resources Director for Miami-Dade County. I have been with Miami-Dade County for 33 years, all in HR, different aspects of HR. Started off as payroll processing, so I know all of the ins and outs, so that the staff can't tell me what can and cannot be done. I've kind of like worked my way up and really have been a part of every aspect of human resources. I was very involved with labor negotiations. I am very involved with labor negotiations. We have 29,000 county employees. 90% of whom are represented by one of 10 bargaining units. We have a total of 8 unions, 10 bargaining units. And I chuckled when Rena said that she has a panel of experts to talk about COVID, because one of the things that I can tell you is none of us a year ago were experts in anything that had to do with COVID. So, we have all learned, and, none of us really knew what to do. So it's been a challenge. It's been, a learning experience. I always said, even before COVID, that in my 30 plus years in human resources, there is not one day that is the same, that, I learned something, literally, I learned something new every single day. And that's part of why I love what I do. I love, working for Miami-Dade County. It's a great organization. All of the different departments that Miami-Dade County has, they touch our residents in one way or another. And it's wonderful to be a part of that. So I am also married. I have 4 children. And as far as COVID, we're going to be talking a lot about human resources. But one of the things that I learned with COVID was that I had the opportunity to experience not only the work from home, but schooling, virtual schooling with children. So it gave me a perspective for even our employees that they have to deal with children at home. And now they're not only, a HR professional or, whatever they do in their 8 to 5, but they also have the added responsibility of dealing with children of different ages. So I've gained a great appreciation for all teachers as well. Not that I didn't have it before, but there's a lot happening with COVID. And I turn it back to you, Rena. Thank you.
Thank you very much, Arlene. And yes, we'll talk a lot more about COVID. And I do consider you experts, but yeah, as I said before, we would think that you have seen it all, but maybe not, right? Maybe not. David. Welcome.
Thank you. And I am honored and thrilled to be here. And thank you for the opportunity. My name is David Kahn. I'm the Director of Human Resources for Broward County. I've been with Broward County for approximately 3 years. I've been in human resources for approximately 25 years. So I'm helping add to that 100+ years of experience that we as a panel have. I started in leadership and organizational development. We all have our in for HR, and that's how I got my start, and have spent most of my career in government and in healthcare. So in talking about COVID, I was looking through some emails a couple weeks ago, and I found my first COVID email, which goes back to January of 2020. And in that email, they didn't use the word COVID, but I had an employee who was saying, I have a coworker in the cubicle next to me who's coming back from on a vacation from China. And should we let this person come back because this thing is going on in China? And that started our conversation. And I am thankful that at the time we said, we'll keep the employee home. But this was before we knew about being home for 2 weeks. This was before we knew about no one had masks. This was before everything was happening. But we did have the employee stay home for a little bit, which made me feel good as I was going through that email trail. But the fact that we've been this started over a year ago for most of us, and obviously went into hyperdrive March and April, but nothing could have prepared any of us for what we're going through right now. And in HR, we always say, every day is different from the last. It's just when you've seen it all, something new happens. And I used to say that maybe once every 2 weeks, once every 3 weeks. I can tell you over the last year, I say it twice a day, because every day, there's something new, something unexpected, whether it's an employee situation or changing guidelines from the CDC or the Department of Health. And if I've learned one thing or been reminded of one thing over the last year, it is the need for flexibility and the need to bob and weave and move with the times and adjust, and not just for myself, but to bring my whole team along with me, because there is a lot of bobbing and weaving that we've had to do over this last year. And we're not done yet. There's still a lot more to go. So as we may be COVID experts right now, but that's only because we've been thrown into the deep end, and unfortunately our training is not yet over.
I agree with you. And then I heard something that said vaccination and education. So I guess it has to do with training. And we'll talk about vaccinations as well. Thank you very much, David. How interesting. January, that employee saw it coming, and many others didn't see it coming, but thank you. John, Mr. John Prats. Hi, John.
Hi, good morning, Rena. Thank you so much for the invite. It's a pleasure to see so many friends here today. It's like a reunion. I feel like half of the folks here are from the county. So it's a pleasure. Well, to tell you a little bit about me, this sums it up. If I can show you really quick, my wall here, I have guitars all over my wall. And, I like to feel, it makes me feel at home. So that's pretty much me. I'm a musician, been a musician all my life, and that's really where my passion lies. My passion for people, my passion for singing. I left Miami-Dade County. Miami-Dade County was a blessing for me. I was there for 36. I'm looking at my going away plaque. I think it was 36 point something years, almost 37. And I missed it. I knew I was going to miss the county because I grew up there. I was a kid when I started. And my last assignment, I was a bureau commander with Miami-Dade Corrections, in charge of, we had 3,069 employees, if I remember correctly. And I had a HR staff of about 53, which would fluctuate, 53, 57 sworn staff, civilian staff. And it was an honor to serve in that role. When I left there, I went to the private sector working for a not-for-profit. Little Havana, one of the largest not-for-profits in Miami-Dade County. And I was immediately touched by their mission and their vision to take care of the disadvantaged elderly. I was working there when the pandemic started. And we, not-for-profits, were poor. We had to make some tough decisions. I wanted to furlough employees. My CEO said, John, we can't afford it. So we ended up laying off employees. So the first thing I did right before leaving to come to the city of Doral was to lay off approximately 90 employees. So, and a lot of those employees will never come back. So it's been a tough ride. And immediately when I came to the city of Doral, we had already sent employees home. We were telecommuting. Although I have never telecommuted, as you can see, I'm here in my office. I've been here ever since. Even when the city hall was closed, I was coming to work every day and making a lot of tough decisions. Around May, we started gradually bringing everybody back into City Hall. Effective June 8th, everyone is at work, and we are very, we don't even like to make reasonable accommodations to work at home. If you're sick and you cannot work, you may need to take a leave of absence. That's usually our stance. We want City Hall is open, everyone is at work. We mandate testing. Everyone in the city, we have approximately 500 employees. Everyone must get tested about once a month. We pay for the testing. We do testing at City Hall. We've paid, I'm not even going to tell you how much money we've paid, but we test every single Thursday, and we get the results over the weekend. We also work with a laboratory here in the city of Doral, where we can also alternate and send employees, especially we continue having that policy of having to provide 2 negatives. So we don't follow the CDC guidelines. As far as we're concerned, they're not experts either. No one understands what. And I have a medical director that I speak with, Dr. Pete Gutierrez, our medical director at police. He's a wonderful, I've learned so much from him. And I love that he starts out by saying, John, we don't know anything. I love people that tell me that, because I trust him. We don't know anything. So we always err on the side of caution. One of the largest problems that we've had is employees that travel, especially when they travel internationally without us knowing about it. And then we've had some issues, especially with the PBA, with the union. We're having some issues right now because we're putting our foot down. They can grieve it. We'll fight it to the end. As far as we concern, we have policies on it. It's going to be on their own time. If anybody travels internationally, they will have to stay at home for 2 weeks. And we want to see a negative test done before they return. So I'll stop with that, and just, again, it's a pleasure to be here.
Well, thank you very much, John. I really appreciate it. And how interesting that after 2 months, people were kind of coming back to work and doing the testing. And yes, it's a lot of money that organizations are spending in all those kind of benefits to the employees. But John, I am surprised you didn't actually write a song about COVID yet.
I did.
Oh, no.
COVID is the new. I can do that in a moment, but I'll leave it there.
Well, thank you very much, John. Thank you. You finally sang a song for me. Anyway, so let's just move on, and here is another question that might be interesting to hear from you. In March of 2020, that's when kind of things got serious. When employers actually, they began requiring that non-essential employees stay at home, and some employers, again, not all of them, few of us could have imagined that a year later, 11 months later, many people would still be working at home. Employers found at that point in time necessary to re-examine their benefit offerings in order to make decisions that best support their workforce. So employers continue nowadays to alter their benefits, such as paid and unpaid leave policies. John just mentioned a couple of them, or flexible leave and reimbursing for remote work expenses, which I know that it's kind of very unlikely to happen in most organizations, but some are. This is as a response to the pandemic. So are you one of the organizations that have had to modify the benefits or kind of look at them again in order to accommodate the employees to this situation? If yes, which are some of the benefits that, a couple of them that you can mention, were altered or modified as a result of COVID-19? Now, if you did not modify any of the benefits, are you looking into modifying any with the experience that we have gone through during COVID? And what benefits would it be? This has been a very bumpy road. Again, we are learning as we go. Every day it's a learning experience. So what benefits would you modify if you haven't modified any as of yet? Which benefits would you modify moving forward? Like, for example, working from home. We know nowadays that it's doable. I was talking with an attorney the other day, and she mentioned that now we are doing depositions via the Zoom platform. This is one thing that in the past, prior to COVID, we wouldn't have thought that could be done over the internet, but nowadays it is done. So what is your take on it? Any benefits that have been modified or you're planning on modifying? Bill? You're muted. No.
Okay, well, our experience is very similar to the experience that John has in the city of Doral. And John, how many employees do you have with the city of Doral?
Approximately 500, Bill.
500. We have 130 full-time employees, and at our peak, we're about 100 part-time employees. That includes the summer camp staff. So, we have a much smaller workforce. I can tell you that I'm both the risk manager and the HR director, and I can tell you that many people here have two jobs. Our city manager also, and he's unique, but he's a real workhorse. He is also the finance director. We have, for instance, our public information officer is also somebody she works in our professional services department for helping out with procurement issues and grant writing. We have everybody has just a lot of heavy workload. When you're a small city, even adding one position is a big deal. So we want to make sure that it's justified. So it's a little bit different, I think, than in a large organization like the county, both counties, Broward County and Miami-Dade County. When COVID hit, so most of our workforce, out of that 130 full-time employees, about almost half are in our police department, police officers, police dispatchers. Those people could not work from home. Our police dispatchers are also handle people who walk in the door, and not all dispatching units do that. They handle walk-ins. So they need to be physically on site. Of course, police officers do. So that's the largest portion of our workforce. We also, our second largest is our public works department. Those are the people who are also picking up the trash. They needed to come in every day. So nobody in our, there were no work at home jobs in our police department or in our public works department. The third largest department is parks and recreation. I mean, that's something where people physically come to work. We actually had them coming to work and helping us throughout, even when City Hall was closed, and they did a great job. But those are jobs that typically can't work at home. The jobs where people probably might be able to work at home are jobs like maybe the finance department I can think of, but we really don't have too many of those white collar jobs that other cities have. And when we did that, we did briefly have some work at home. It wasn't really a success. And that was the experience also of a lot of other, small cities. And there was also some morale issues where when you had people for instance, in the police department, the public works department, come into work every day, and they had, the people who were maybe higher paid and working in professional positions not coming to work every day. It created an equity issue there that, I think that, I think that's going to continue to be an issue, both in the public sector and the private sector. People who are hairdressers and plumbers and that, they can't work from home. People who are executives can. So that's, that was another issue. Things have changed in the sense that I don't think we were really open to, for instance, online meetings. We weren't open to online meetings or even online interviews, remote interviews. We are now. So things have improved a little bit in that regard. As far as when you talk about benefits, the biggest benefits issue that we encountered was, how to handle this sick leave. And the federal government, when they passed that FFCRA, that for the most part was a big help to a lot of people. And the city did get reimbursed quite a bit for that from the county. So it was a big help, and it's now since expired. I was shocked when they let it expire on December 31st. And it has created a little bit of a problem after that. But that would be the one benefits issue that I can think of. Workers' comp is another issue that seems to not be working as well as at least not for people who are not in law enforcement. It's not working as well as I think it should. But so our experience, I think, might be very different from the counties. I also, like John, never missed a day of work. I did break my ankle over the course at home over the course of this pandemic, and I was back the next week. My city manager has shown modeling behavior and been to work every single day. He has not missed a single day. So, and that the culture in a small city can be very different. The one thing I would, finally like to add is that this forum, this symposium, is in the whole networking aspect of ASPA is really important to public administration professionals and including HR professionals, because Arlene, all of us, I think, we're probably in the same informal email lists, and it used to be like a we're all communicating with each other. We're looking to see what each other is doing and their policies, and to try to find the right path for us. And that communication and interaction with peers in different agencies has been really, I think, the value of that has really been the thing that I learned is so important in the field of public administration. So that's all.
Agreed. Thank you, Bill. Thank you. Very informative. How many people were working from home at the beginning? About what percentage of your workforce?
Oh, we had no one. We're very, very similar, I think, to John's workforce. I thought his might be a little different because it's a little larger. For instance, John, I think mentioned to me before that he has 22 people in his IT department. We have 2 people in our IT department. Those people can't work from home. Those people need to be on site. Like I said, most of our people, if we look at the building department, for instance, we've got people bringing in blueprints and that for the building permit people. They need to be here. Our code compliance people need to be here. They need to go and do that. Our inspectors need to inspect buildings and so forth. So virtually every job has that as a requirement. And we found that, and there's studies, I know there's a lot of studies on working at home. There's, where people see the benefits of it, but also, that interaction that you have. I think it was Yahoo many years ago, they had let it, I think, everybody work from home, and then they brought everyone back. But I remember them talking about the value of cafeteria and hallway conversations, and that kind of interaction with each other, that the ability to to communicate and to meet with people in person, is very critical to the success of the organization. So.
That is right. As a matter of fact, I've heard that some people feel that they have better promotional opportunities within the organization if they are in the office environment and being seen by their supervisors and peers more often than just remotely working. Well,
Out of sight, out of mind. Out of sight, out of mind. That's right.
Yeah, well said. Thank you very much, Bill.
Thank you.
Arlene?
Karina, thank you. Yes, Miami-Dade County has been reviewing policies and making changes as needed. Going back to March, we immediately implemented our leave policies. We were afraid that employees were going to be using their leave and being without pay, and we were very concerned about that. We implemented for a short period of time, we allowed employees to go into what we call negative balances. We did that for a couple of months until the FFCRA, the paid leave from the federal government kicked in. And, that helped employees, continue to receive a paycheck for, some very difficult times back in March. We also allowed, we have what we call leave conversions, and you can only accumulate up to a certain number of hours in your leave year. We waive that provision for 1 year. We're coming on 1 year now, where employees, if they were going to lose or forfeit any leave because they couldn't take the time off, they were required to work. And I'm specifically talking about our fire and police and corrections, where those employees also, they can't work from home and they can't take the time off. We needed them more than ever. So they were our heroes, and they came to work and they forfeited vacations. So we changed our policy so that they wouldn't have to forfeit those hours. And that, again, was a temporary leave policy that we implemented for a full year. We also, with our benefits, as you very well know, in our benefits area, we waived the co-pays for our telehealth and really encouraged employees to take advantage of telehealth instead of going to a primary care physician or to an urgent care or even an emergency room. So we waived the co-pays for our employees for telehealth. That was a temporary provision. Also, we're going on 1 year on that. And also prior to the pandemic, we had our insurance for our new hires had a 60-day waiting period for insurance. Immediately in March, we changed that last year in March as a temporary, again, provision because of coronavirus. And we provided day one coverage for our employees, and we still have that today. We are reviewing those policies ongoing and make changes as needed. With regard to the work from home, we also very quickly implemented a work from home. In our area in HR, my priority was to get as many people home as possible, specifically our payroll staff. We needed to make sure that payroll for 29,000 employees went, without a hitch every 2 weeks, because we were paying those police, fire, corrections, our solid waste, so many of our critical services for Miami-Dade County. We immediately, our payroll staff, we could not afford to have one person test positive and have to wipe everybody out and they not be in a position where they could continue to work. So we immediately sent them home. You have to kind of like scramble, who has a laptop, who doesn't. All of that technology needed to be worked out. That was something new for all of us that had to deal with work from home. And then you had work from home issues for some employees where, their Wi-Fi connection wasn't working, or their kids are now at home and everybody is competing for the same Wi-Fi connectivity. So all of those things, we needed to deal with. But what I want to say about working from home, it doesn't have to be an all or nothing. Many of our employees are also on what we call a hybrid working from home, where some employees are required to come into the office. They may have some work that they need to do. And then, some of the days they're able to work from home. Our goal with the working from home was to reduce the footprint, to reduce, physical presence in the office, to minimize the number of employees in the office at the same time. So you also want to look at staggered schedules if you're implementing work from home, or if you're implementing or you're having employees come back to work. You know, the county, like the cities, you know, we provide direct services to our residents, our police, fire, corrections. They just can't work from home. So we only have, out of our 29,000 employees, we have about a quarter of our employees that may be able to work from home. So we've had from, you know, going back a year, we've had anywhere from almost 8,000 employees working from home in a pay period to about an average of about 7,000, 7,200 employees working from home every single pay period. And again, that can be a hybrid model. It could be that they worked from home, you know, 2 days out of the 5-day work week. So it's been very successful. You know, I think that, you know, initially when we were telling people to stay home, and we were really doing it, you know, for protection and to ensure that we were reducing the footprint. You know, many employees were very skeptical. Many employees were very reluctant. We had managers that were very reluctant. We had to say, no, 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 they should be working from home. If they are productive, and that's always the key, right? So if they are productive, then they should be allowed to continue to work from home. Now, this does require, you know, from managers a little bit more work on the front end, because you really do need to manage your remote workers. And it does have to be a proactive approach. You do need to have regular interaction with your, with your employees that are working from home. You know, one of the things that I always tell my staff is, you know, put it on the calendar. You know, make sure that you're meeting with staff on a regular basis, whether that's a one-on-one or that's in group settings. I would always, you know, have, you know, regular meetings, and I was having phone meetings. You know, I switched to having from phone meetings. I ensured that my meetings were recurring on Zoom. And the reason for that is because you do need to see people. You do need to interact. And a telephone call is very different than a Zoom call, and very different to an in-person meeting. So, you know, what you know, I guess we've adopted and embraced working from home. You know, there are a lot of benefits of working from home, as you know, there is work-life balance. It reduces on commute for employees. Employees have indicated that they're much, you know, that they have less stress, not having to deal with 1 hour commute to work and the traffic. The traffic alone is a huge benefit, not only for the employee, but for our community. You know, I know that it's been said, well, we solved the traffic problem. Well, we haven't exactly solved the traffic problem, but it is a little bit better in Miami-Dade County. So all of these things are positive things that we need to say, you know, COVID has been a terrible thing, but there are certain things that we could take away from COVID that have really changed the work environment for many employees and the work going forward. We also have, there's also a benefit for organizations where they need to rethink and relook at their real estate. You know, by having employees work from home, all of a sudden, you don't need an office for every single employee. You can have what, you know, is called hoteling, where you design spaces where employees can kind of reserve when they're going to come in, and you alternate that, and that's scheduled. And you could reduce, you know, the real estate that that is, you know, that the organization has to have for their workers. So there are a lot of benefits. We're still learning, as Bill mentioned, and he's absolutely right. You know, there is a sense, you know, on the negative side or on the con side, there is a sense of isolation, and, you know, you do need that interaction with, you know, face-to-face interaction with employees. So that, you know, that is a component of this coronavirus. Obviously, you know, we have seen, you know, in the HR world, depression is up as a result of COVID. And that can be because of, you know, so much isolation and, you know, so much uncertainty. So those are the things that we need to take into consideration. You know, just going back to the topic of this seminar, you know, placing humanity, we have to remember that we are dealing with individuals, with people. And one thing that I can say is that, you know, we need to be flexible, yes, but we also need to remember that one size does not fit all. And we have to look at every individual case, and we really have to, you know, be the advocate also for our employees. So yes, Miami-Dade County has implemented a number of benefits, and we will continue to review and monitor whatever, whatever we need to do.
Thank you, Arlene. I was reading an article that managers were having a hard time in monitoring the performance of their employees that are working from home. So the issue was, how do you monitor? How do you ensure that your employees are being efficient and effective working from home? How do you monitor their performance? So they had either task or time. How do you monitor them? And they recommended task, because time is very difficult, even in the office. If you see a person sitting in the same cubicle from 8 to 5, how do you know that they are actually working? So if you would implement something that is task related, okay, this person needs to do 100 phone calls in a day. If they do, maybe that's the way to monitor, but it's not easy, Arlene. So thank you very much. All those benefits are really benefiting about 30,000 employees. Thank you, Arlene. David?
So in talking about telework, we did implement that fairly quickly last year. And we did it primarily for social distancing and to have less people in the workplace. And we did decide which positions would be eligible based on their responsibilities. That number grew as public buildings did not allow the public to come in. So a lot of that customer service was happening more over the phone and through the web versus through our counters. So that helped. And the key that for us for telework, and something that I have been stressing ever since, was successful telework takes place when nobody knows where you are and no one can tell. It's a seamless delivery of service. So it doesn't matter right now if this fake background I have behind me has a beach right behind it. If you can't tell where I am and I'm able to get everything done that I need to get done, then there shouldn't be an issue. And whether this is exempt or non-exempt. So when you talk about tracking, we started with task-based tracking from the very beginning. We had and we still have a worksheet for the week, with assignments at the beginning of the week and an assessment at the end of the week to see what was completed. Many of our positions are exempt. So as we all know, the hours in the day don't really make as much of a difference with exempt. It's you work till the job is done. So that made the task-based a little bit easier. We also worked with our IT department so that people didn't have to touch the time clocks. That was, from a germ perspective, that was big. We didn't want people getting together in the morning or at the end of the day at those time clocks. And that allowed employees to be able to clock in through their computer, which helped for our teleworkers as well. Everyone who was teleworking had to have county equipment and also had to be on a secure line, our VPN line. And we have and part of our policies and part of our IT improvements since the very beginning, we now can monitor whether somebody is clocking in or out through a secure VPN server or on their phone somewhere else. So that makes a big difference for the tracking as well, because obviously for the non-exempt staff, you need to make sure that they're actually clocking in and out the correct way. And from a security standpoint, as you all know, with COVID, we've had a spike in our attempts to hack into our systems from an IT perspective, and that's been a huge issue. So we've had to be even more diligent than we were before, which has taught us some new ways to utilize our technology. As we're talking about policies, I would say our leave policies probably had the most of the changes. In some ways, we were being more lax with our leave policies. We suspended our sick leave monitoring that looks at the abuse of sick leave, because we did not want in any way to discourage employees from taking time off when they didn't feel well. So those are still in place. We did sign LOUs with our unions to get that done, because that was a change in the CBAs. And we've had a couple different LOUs with them over the course of the last year to ensure the safety and health of our staff. Now, when we're talking telework, about less than a quarter of our staff were deemed to be eligible for telework, and no one was teleworking consistently for a long period of time. We had people working in shifts. Typically, it was an A week and a B week. So this week the A week is there, next week the B group is there. And that way, if somebody were to get sick, if there was a suspicion that somebody might be sick, we don't lose an entire department. We lose maybe half. And the ones who, and if we were to lose people that can't come in because they're isolated, but they're still healthy, they'd be able to telework in that time as well during that isolation leave. So we were trying to make sure that the work could get done while respecting people's health. We also were very concerned with the haves and the have-nots, those who could telework versus those whose jobs didn't allow it. So for those who were not eligible for telework, we imposed a 32-hour work week where they would work 4 days and then be off for a day and be paid for that day. For that day, that would be throughout the week, different people would have off. So at any point in time, you have 20% less people in the workplace. And that was received well. That did end at the end of 2020, but we did have a lot of success with that. And it did help when we were doing contact tracing and keeping people out, because you could always ensure that that group who was always out on Tuesday had less exposure to the people who were out on Monday, Wednesday, Thursday, Friday. So those were some of the policies we enacted. And like I said, it was mostly based around the health and safety of our staff and ensuring that our residents receive the services that they should be receiving.
Well, I think that those changes were very creative, David, very creative. And I think that the morale for those people that had to report to work, being 1 day off in the week, was a morale booster. I really commend you for doing that. Thank you. John?
Let me unmute the mic there. David used the word flex, that we have to be flexible. You said that early on. One of the things that we found out during a survey of HR professionals is that I think we were the only city early on that decided to treat any work-related COVID-19 exposure as a workman's comp issue. At the time, our workers' compensation carrier pushed back on us, but we said no, and they started accepting those claims. Then we recently had a change in carrier, and now they are quoting state statute. So now we have a problem. We promised our employees when we said you have to come back to work, we're going to treat it as workers' compensation. But now, so we're standing by our promise, even though workers' compensation is not approving those claims. If you are not a police officer, we are paying those employees time at the same 66 2/3 rate, just like if they were on workers' compensation. So we're taking care of those employees. Also, with the end of with the Families First Coronavirus Response Act, we're still continuing to take care of any employee. If an employee calls us and says, look, I was exposed at home, thank you. We appreciate the honesty. Stay at home. We are, for an exposure, we're doing the 7 days. We are requiring most of at least one negative, but usually 2 negatives. And we ask for the second negative on the 5th day. Why do we do that? Because people want to know upfront. So they usually take one test, but we are looking for a negative before coming back to work. And that time is on us. We're paying for it. There is no sunset provision. We're just continuing to take care of employees. So we're not charging their time for that. So we're trying to be as flexible as we can. When those employees call us and tell us, look, I'm not sick, but I was exposed. If they are able to work from home, we assess it, and then we do implement the telecommute policy.
Well, John, thank you very much. I know that workers' compensation is kind of tricky too, because they are supposed to cover an accident on the job, but this is not, COVID is really not an accident, but an incident kind of thing. So that was kind of the debate in, in some of the litigations. I guess there is one that Publix is going through. Now, guess what, my panelists, we are almost out of time. Can you believe that? So let's take a couple of minutes to answer some of the questions. And I did have more questions for you, but you guys have been great. So let's see if we have any questions from the audience. We have Mrs. Olivia Jackson. She is asking, what is your stance on requiring employees to sign waivers to mitigate suing or holding employers responsible if they contract COVID-19 after being required? It moved. Let me see. After being required to return to in-person working. If this policy applies to your city or county, is this an administrative nightmare to enforce?
Miami-Dade County, we do not have such a waiver.
We don't either.
We don't either, and I'm not sure how enforceable a waiver like that would be. There are a number of lawsuits around the country right now, more in the private sector and the public,
Right.
with people being sued. I will tell you, we are following the guidelines of the CDC and the Florida Department of Health. So I feel it does help mitigate risk. And if we decide we're going to change that, we go farther. We don't try to scale back what they're suggesting we do.
Thank you. This is another question asked from Mr. Thomas Watts. While there is social interaction as a positive for working traditionally, in addition to the advantage of working in the comfort of their home environment, there is the financial expenditure advantage of not needing to pay for office space in the larger organization, except for necessary activities such as IT, as mentioned. One large organization in a pivot industry was able to cease paying rent for leasing office space for 30 of the 36 floors they occupied in a building. How would your organization benefit from savings in financial areas in leasing space? And could you use part of those savings to give back to employees for productivity?
Rena, I can tell you that the city of Miami Springs has all of its workers in government-owned buildings. We don't rent any space. When we may rent a community policing office, but that's just a very small office. So we would realize no savings from teleworking. So we'd have maybe some empty offices or bigger offices in City Hall, but that's about it.
Thank you, Bill.
Yeah, I'd say the same thing with Broward County. Most of our properties are libraries, parks. Those are places where the public is physically in there. So you need staff who are working in those places. So yeah, maybe a couple empty offices, but a lot of our staff are public facing.
Got it.
One of the things that very quickly has helped me throughout my career has been God grant me the serenity to accept the things I cannot change. You all know that. There are many reasons, sometimes beyond our control, of why we have to have certain policies, why we must open a city, et cetera, et cetera. And sometimes it's definitely above my pay grade. But there are optics. There are many situations other than money.
Sorry, that was time up. That was my timer. What can I tell you? Well, thank you so much from the bottom of my heart for agreeing to participate in this panel. I think that you have been wonderful. And if I said at the beginning, you're experts, you are to my eyes. All right. And I know we are learning every day, every minute, and it's all of us learning. And yes, John, I was going to ask you to play a song for us. So we can say goodbye.
I had a whole hour of music ready.
I know, but please make sure that you do purchase the book from David also. I think that it's a super interesting reading. It's already on its way from Amazon, and you can find in his bio towards the end of the program. Bill, Arlene, David, John, thank you so much for being part of this panel, and I look forward to seeing you later on at any time in the building or Zoom or in whatever way. Thank you so much.
Thank you so much.
Thank you very much. Pleasure.
Great seeing all of you.
Thank you, Rena.
Thank you.
So thank you, guys. This was our HR